Hi folks, my name is Katie, and as you heard during the all-staff meeting, I'm the project coordinator for upcoming PT and OT rehabilitation services here at UIHS. I wanted to put this brief presentation together to introduce these services and give you a chance to ask questions. I promise I won't take up more than a few minutes. So to start, I think it's important to clarify what we mean by rehabilitation. This could refer to many different things in many different clinics, but what we're talking about here at UIHS are these services provided by a physical or an occupational therapist that are intended to restore function. Now, our approach, of course, is client-centered and holistic, so what we mean by function could look different depending on who you are and just what it is that you need. So of those two disciplines that we'll offer, I wanted to sort of provide a definition so that you all understand the difference between them and what it is that they focus on. So the American Occupational Therapy Association states that occupational therapy helps people across the lifespan do the things they want and need to do through the therapeutic use of daily activities. This is what we're calling occupations. So I think the thing to note here is that when we are talking about occupations, we aren't talking about jobs. We are talking about day-to-day activities. It's pretty common to confuse occupational therapy with occupational health. It's kind of an unfortunate naming situation there. What we're talking about having here at UIHS is occupational therapy. Occupational health and safety, what you might think of as OSHA federally, that's another thing entirely, and it is associated with jobs. And then there's PT. So the American Physical Therapy Association states that physical therapists are movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. So it's that mobility piece that's the specific area of expertise we're talking about when we refer to PT. Now, both PTs and OTs are highly qualified practitioners. Both go through extensive medical schooling and hands-on training. Starting with a bachelor's degree in anything from psychology to exercise science, they both sort of follow the same general course. That is, they obtain a master's or a doctorate level degree in their field. They then rotate through several fieldwork placements in different settings to prepare them for any of the many different areas they might work in. And finally, they take a national board certification exam in order to be eligible to license for practice in their state. So now that you know a little bit more about what we will provide and how we are qualified, let's talk about who we would serve. So it's important to note here that most people will benefit from a combination of PT and OT. So I'm not going to differentiate between the two for a second, and I'm just going to talk about some of the reasons that someone might seek those coordinated services. So, for example, you may have had an injury or a surgery, and you find that you're unable to do the things that you used to do and want to be able to do again. Or maybe you're going through a big life change like aging or getting housing, and you need strategies for a safe and meaningful transition. Or it could be something like memory and thinking changes that mean you're struggling with activities that were once easy and important to you. And then my last example here are those folks who have a developmental condition. That means they interact with their environment differently than other people, and they'd like support navigating their world. So breaking it up now between the two disciplines, what a PT might do to help someone who is dealing with any of those things we talked about on the last slide is that they might help you become more physically fit to do what you want to do. Or they might help you specifically control the movements of your body. They also do great work using movement to help manage and relieve pain, as well as educating people on physical impairments or changes. Whereas an OT, addressing the same person, might be working to support them in participating in roles and routines that you need throughout your day. They could help you become more physically able, but they could also help you become more cognitively able to do your activities of daily living. They also have an important role in the management of pain in order to keep you participating in your day-to-day life. And this could involve teaching you strategies to adapt or modify the activities that you're trying to do. So more specifically on this slide, I just have a long list of some of the more common referrals that we see in PT and OT. A few of those that I want to highlight here are amputations, such as those related to severe diabetes, chronic pain, traumatic brain injuries, cognitive decline, carpal tunnel syndrome, and even just general deconditioning. So now the fun part. What comes next for UIHS? Obviously, these services are not up and running yet, but they are well underway, and we are kind of moving through the planning process at this period. One of our priorities right now is naming the program, so stay tuned for an official launch. We're also actively setting up our new space in Eureka 2.0, which will let us start hiring soon and then providing services, ideally sometime this summer. Now on this slide, I just wanted to give you a bit of a sneak preview into what our program will look like specifically when we do get up and running. I think the most important thing to emphasize here is that we are being really intentional with this process. There are some things that we know we need and others that we won't know until we start. So we're starting realistically and we're starting small in order to really understand what this looks like for our community before we get carried away and make too many assumptions. So to start, we'll be looking to hire just one PT and one OT, providing sort of generalist adult services. We'll be piloting this program out of Eureka. Now, we are hoping to expand all of those things, more providers, more varied populations, and importantly, more of our service area. But this will take time and careful planning to do sustainably so that we don't make promises that we don't have the resources to support yet. Now, if you do have questions or are just generally interested in learning more, I've got some resources on this page. But what I really want to point out to you is my email address there at the bottom. Please email me. I love talking about this stuff, and I'm super excited about this program in particular, so do not hesitate to reach out. As a matter of fact, if I get a lot of the same types of questions or concerns, we might be able to address those more publicly in an all-staff meeting. Okay. I think that's all for me. I look forward to working with you all more closely and helping this much-needed program come to life.